So do you have pain in your neck that causes pain, tingling, runs down your arms? You have weakness in the arms or shoulders, stiffness in your neck muscles, and you get constant massages, and those massages don't tend to hold very long. You may get relief for about 24, 48 hours, and then after that, you have the stiffness that remains. Is it hard for you to move your head? And do you have numbness and tingling and weak arms when you wake up in the morning? If so, you can have some common degenerative changes occurring in your neck, and those degenerative changes can be fixed through conservative physical therapy. So let's talk a little bit about what's happening. So our society right now sits or stands in what we call a static posture. And typically your head is forward and your shoulders are rounded. And you've heard this. It's the new trend that sitting is now the new smoking. Well, it's true. And let's talk about this and see what's happening in your neck. So when you're forward like this, most of the day using a computer, and then you go home and you're using and doing Facebook at home with a tablet or a cell phone, or you're in the car doing this, which you shouldn't be doing, then you're actually placing an increased pressure on the nerves, and those nerves run down the back of the arms into the hands. Now, this is a happy neck, and this is one that has degenerative changes, and typically these degenerative changes are happening between the ages of 50 and 70 years old. We're actually seeing in the clinic some 35, 40-year-olds that have degenerative changes. So those degenerative changes have some fancy words that are placed behind them. Stenosis is one, and stenosis is actually a narrowing in the foramen. So your spinal cord comes down here. The bones here, when you're forward, instead of being stacked like they're comfortably supposed to be stacked, they're forward because your neck is forward. And so it's narrowing the foramen on the back side here, and that is actually pinching the nerve and the space into the spinal region of the neck. That can cause pain, numbness, and tingling running down the arms. Now, the next thing is degenerative disc disease. Degenerative disc disease is actually where the disc loses its buoyancy and stiffens, and as it does that in between the vertebrae of the neck, it squishes down, and when it does that, then you're sitting on the nerves that come out on the back of that as well. Now, the other more popular things that we see here in the clinic are osteoarthritis and arthritis. And these degenerative changes are actually happening in younger ages right now and can create an enlarged facet, which is the back side of the vertebrae here. It's the pokey things back here on your neck. And that enlarged facet actually causes a decreased space. And with that decreased space, the pressure is on the nerve and causes numbness and tingling. Now, it's a pretty complicated thing that is happening behind the scenes, but your body, your joints are sending off responses to your muscles to tighten up. Those muscles are staying tight. That's why massage and treatments like that are not lasting. You need to get in to see somebody to see exactly what the cause of your neck pain is, and you need to see what successful treatment looks like, because this type of treatment can be performed conservatively without injections, medications, or potential costly surgeries. And to do that, you need to find a physical therapist that understands the underlying causes of the neck pain and can treat it successfully. So a quick test that you can do to see if you do truly have some degenerative changes that are happening is if you're in this position and you turn your head and it's stiffer in one direction than the other, then you automatically know you have some possible arthritis or degenerative changes. When you bring yourself back up in good posture, your chin is tucked and you rotate and you have stiffness to one side greater than the other, that's also a positive test that you have some degenerative changes. And you need to seek care that will help mobilize the cervical spine and open that up so that you can strengthen those muscles and regain the strength as well as the mobility in your neck. Hope this helps. If you do like this and want more information, hit the like button below here and just add a quick comment and I'll be glad to get back to you and talk about this a little bit more. Hope this helps.